Hi, I'm Dashalini Panchulam with metric number U6230040. Today, my team members and I are here to present on the medicinally important heteroaromatic compound. Heteroaromatics are aromatic compounds with heteroatoms like oxygen, nitrogen, and sulfur in their cyclic conjugated pi systems. So here, we will highlight on the examples like carbimazole, histamine, and Benzhexol, where we'll be presenting and explaining on their structure, nomenclature, mechanism, interaction with humans, medicinal use and application, and also some other beneficial information related to these examples. My example is on carbimazole. Carbimazole is a medication for hyperthyroidism which includes the Graves' disease. Graves' disease is an autoimmune disorder where the immune system attacks the thyroid gland, causing it to produce too much of thyroid hormone. It is a prodrug which is converted to methimazole, blocking the thyroid hormone synthesis and reducing the symptoms like weight loss, rapid heartbeat, and many more, which requires the monitoring for side effects, example like agranulocytosis and liver toxicity. This slide presents on the structure and nomenclature of carbimazole, where the first one is the 2D and the second one is the 3D structure of carbimazole. The IUPAC name of carbimazole is 1-methyl-3H-imidazole 2-thion 3,2-methoxy-carbonyl propyl. The chemical formula is C7H10N2O2S. The alternative names given for carbimazole are neomercazole and carbimazole. Now I'll talk on the chemical insights of carbimazole. First one is solubility. Carbimazole has poor water solubility, making it difficult to dissolve in water. It dissolves better in polar solvents and its solubility increases in acidic environments, aiding its absorption into the body. Second, conversion into methimazole. Carbimazole is a prodrug, meaning it's converted into the active form of methimazole in the liver. Methimazole will inhibit the thyroid peroxidase TPO, an enzyme responsible for the thyroid hormone production. The third chemical insight here is the stability. Stability explains on the carbimazole, which is stable at the physiological pH, the normal pH of the body. However, it can be hydrolyzed, or in simple word, can be broken down by water in extreme pH conditions. The last chemical insights of carbimazole is the reactivity. The thioamide group in carbimazole is reactive with oxidative agents, which is essential for its therapeutic effect. The ester group will reduce the reactivity and will enhance the storage stability. Okay. Next is the synthesis pathway of carbimazole. The synthesis pathway depicted here is a simplified representation and might not reflect all the intricacies of the actual synthesis process. So the carbimazole is synthesized in a multi-step process which involves nucleophilic substitution, intramolecular cyclization, and esterification. So the starting materials include here are 2-iodobenzyl bromide, potassium thiocyanate, and methylamine. So firstly, the thiocyanate ion will attack the 2-iodobenzyl bromide, forming a thiocyanate derivative. This intermediate undergoes cyclization to form a thiourea ring. Finally, the esterification with ethyl groups improves the drug's solubility and stability, and eventually it will form the carbimazole. Now I'll explain on the medicinal uses and application of carbimazole. Firstly, it prepares the thyroid for radioactive iodine therapy. Carbimazole is often used to reduce the size and activity of the thyroid gland before radioactive iodine therapy. This therapy involves the administration of radioactive iodine, which is selectively absorbed by the thyroid gland and destroys the overactive thyroid cells. Secondly, it reduces the symptoms of overactive thyroid. Carbimazole helps to reduce the symptoms of hyperthyroidism, such as rapid heart rate, anxiety, weight loss, and tremors. Thirdly, it can be used as a short-term medication before switching to methimazole. In overall, carbimazole can be used to treat the hyperthyroidism. Now, moving on to the interactions with humans. Carbimazole can cause skin rashes or allergic reactions in some individuals. Secondly, it can cause mild arthralgia or discomfort in the joints. Thirdly, it can cause some gastrointestinal issues where a person can experience nausea, vomiting, or stomach upset.
Hi, my name is Yusrifa Adina Ami with the metric number of U6230048. My topic is on histamine. Histamine is a chemical that plays a key role in the body's immune system and inflammatory response. For example, allergic reactions and anaphylaxis. It is found in all bodily tissues but is most concentrated in the lungs, basophils, and mast cells. Antihistamines are a common medication that can manage histamine levels. This is the structure of histamine in a 3D and 2D form. So the IUPAC name of histamine given is 2,1-H-imidazole foil ethanamide, and the formula is C5H9N3, and the alternative name is beta-aminoethyl glycoxylate, 4-imidazole ethylamine, and beta-aminoethyl imidazole. There's a lot of alternative name for histamine, but this is some of it. Next, histamine exerts its effect by binding to 4 types of receptor, which is H1, H2, H3, and H4, as can be seen in the table above. So H1 is located at the blood vessels, smooth muscle, and central nervous system, will cause vasodilation and increase vascular permeability. It can be seen as swelling and redness. Then, it triggers smooth muscle contraction. For example, bronchoconstriction in asthma. It also regulates wakefulness and appetite in a person. For H2 receptor, it can be found at stomach lining, heart, and immune cells. Its main effect is to stimulate acid secretion in stomach for digestion and modulates immune cell activity. Meanwhile, H3 receptor located at brain and peripheral nervous system. This receptor will regulate neurotransmitter release such as dopamine and acetylcholine. It will also maintain sleep-wake cycles. The last receptor is H4 receptor, which is at the bone marrow and white blood cells. Its function is to modulate immune and inflammatory response, particularly in allergic reactions. Moving on to the synthesis pathway of histamine. Its starting molecule is the L-histidine, where it's an essential amino acid obtained from dietary sources or protein metabolism. Then, the key enzyme histidine decarboxylase catalyzes the removal of the carboxyl group COOH from the L-histidine. This reaction requires pyridoxal phosphate (PLP) as a cofactor, which is derived from vitamin B6. Histidine decarboxylase activity can be upregulated by allergens or immune triggers and acetylcholine in the stomach. The resulting histamine is stored in granules within mast cells and basophils or used immediately in neurotransmission or gastric acid secretion. Excess histamine or feedback from its downstream effects can inhibit further synthesis. Once synthesized and released, histamine is metabolized by two main pathways, which is histamine and methyltransferase (HNMT) and diamine oxidase (DAO). Furthermore, there's a few medicinal use and application of histamine in our daily life. The most common medication is an antihistamine that can manage histamine levels and relieve symptoms of allergies, common cold, flu, and other breathing illness. Then, antihistamine like disloratadine can complement standardized treatment of acne due to their anti-inflammatory properties. Next, histamine may accelerate cutaneous wound healing by enhancing angiogenesis and facilitating the exudation of molecules required for optimal wound healing. Moreover, H2 receptor antagonists revolutionize the treatment of acid-related disease such as gastroesophageal reflux disease, where the stomach contents move up into the esophagus. The last one is topical relief, where histamine plays a crucial role to temporarily relieve minor muscle and joint pain. However, there isn't much data on its effectiveness. Meanwhile, for the histamine interaction with human, the first one is that it will cause immune response, where histamine is released by mast cell and basophils during it. It particularly released in allergic reactions. The second one is that histamine will promote vasodilation and smooth muscle contraction, which can affect blood flow and respiratory pathways. The third one is histamine acts as a neurotransmitter in the brain, where it will regulate wakefulness, appetite, and other functions through H1 receptors. The last one is that it will interact in terms of gastric secretion. Histamine stimulates parietal cells in the stomach lining via H2 receptors to produce hydrochloric acid, which plays a key role in digestion. That's all from me. I will pass the presentation to Yusuf.
Hi, my name is Yusuf, and I'll be explaining the final heteroaromatic compound known as benzhexol. Benzhexol is also known as trihexyphenidyl. It is used to treat symptoms of Parkinson's disease, such as tremors. They also act upon other involuntary muscle movements that are controlled by the central nervous system. Thus far, it has been replaced or taken in combination with levodopa due to its side effects causing eye dryness, blurred vision, urinary retention, and constipation. These are considered side effects because they are not the intended purpose of benzhexol. However, these symptoms will arise when taking benzhexol in combination with other anticholinergic drugs. The reason for such can be explained further in the mechanisms section of these slides. However, First, I'd like to go through the structure and nomenclature of Benzhexol. On the left, we have a 2D structure of Benzhexol, and on the right, a direct 3D structure of the same image. Below is the IUPAC name: 1 cyclohexyl, 1 phenyl, 3, 1 piperidonyl, 1 propanol. Below that is the formula C20H31NO. Alternative names to Benzhexol are Artane, Cyclodol, Broflex, and Hexima. There are more brand names, but these are just examples. Next, I'll be explaining the mechanisms and interactions of Benzhexol when ingested into the human body. Benzhexol, usually prescribed as tablets or syrups, but most commonly as tablets, are ingested alongside levodopa or other anticholinergics. Combined with other anticholinergics, it can greatly increase the effects that it has on the central nervous system. How it works is that it binds to M1 to M5 type acetylcholinergic receptors. So all the receptors from M1, M2, M3, M4, and M5. This causes the acetylcholine release in the brain to reduce and meet the low dopamine levels in the brain. Once the acetylcholine and dopamine levels reach a equilibrium or a balance, the tremors and stiffness caused by Parkinson's will reduce or cease entirely. The use of Benzhexol is an unspecific targeting to receptors. So when combined with other anticholinergics, it can cause the side effects of eye drowsiness, urinary retention, and constipation to become more prominent. However, these are considered minor side effects. This is because of its unspecific nature. Since it targets all the receptors of the acetylcholinergic receptors in the brain, it will undoubtedly affect areas that are not of its intended purpose. When consumed with a large amount or a large variety of anticholinergic drugs, it can cause serious side effects such as arrhythmic beating of heart muscles and other symptoms that could endanger a person's life. Next, I'd like to talk about the synthesis pathway of Benzhexol. It should be mentioned that Benzhexol does not occur naturally. It cannot be found out in nature, and it does not exist in other living beings. It can only be made synthetically by other people in laboratories. The synthesis pathway shown here is the linear Grignard reaction, using 2,1-piperidinol propiophenol combined with cyclohexyl magnesium bromide in an anhydrous environment. What is a Grignard reaction? It is a combination of um, a ketone or an aldehyde with a magnesium halide in an anhydrous environment. It must be in an anhydrous environment to properly form carbon-to-carbon bonds. If it is exposed to water during this reaction, it will fail to bond properly, and thus the product Benzhexol will not be formed. Lastly, I'd like to talk about the medicinal use and application of Benzhexol, once again with the interactions to human central nervous systems. Firstly, Benzhexol is commonly used to treat symptoms of Parkinson's. However, it is not only used to treat tremors. It can actually be used to treat any kind of involuntary muscle movement caused by an overactive central nervous system, such as muscle stiffness, akathisia, or dystonia. Akathisia and dystonia can be described as movement disorders, akathisia being the inability to sit still, and dystonia being uneasiness or restlessness in the feet. Uh, Benzhexol is taken as often as it is prescribed by the doctors, usually in combination with levodopa or any other anticholinergic drugs. But it is also taken after meals to reduce the stomach upset that comes from taking so many medicines at once. Once ingested, it will cause the central nervous system to slow down, the activity in the central nervous system to slow down. This reduces the muscle spasms and tremors that are usually found in Parkinson's patients. However, due to the reduced central nervous system activity, it also results in slight drowsiness. It is usually combined with antipsychotics, as antipsychotics bring the symptoms closely resembling Parkinson's. That is all from me. Thank you for listening to our presentation. Thank you once again. Yeah.